Welcome to Focus on Abilities, a program about issues affecting the lives of people with disabilities. I'm Lex Frieden, your host for today's program. I'm professor at the University of Texas Health Science Center at Houston and director of the Independent Living Research Utilization Program at Tier Memorial Hermann. We have an interesting program for you today, and I hope you'll stay tuned to watch it. Before we take a break, however, I want to ask you a question. What is the leading cause of injury among elders in the United States today? We'll answer that before the end of today's program. Stay tuned for Focus on Abilities.
Focus on Abilities is brought to you by Tier Memorial Hermann, redefining rehabilitation, removing barriers, re-enabling independence. In the ILRU Southwest ADA Center, promoting compliance with the Americans with Disabilities Act.
You are watching Focus on Abilities, and I'm Lex Frieden, your host. Today, our guest is Kathleen Stross. Kathleen is with In Harmony Physical Therapy. And Kathleen, thank you for being our guest on Focus today.
Thank you for having me. It's great
Kathleen,
to be here.
you are a physical therapist, and you have a physical therapist business. But as we know, physical therapy can be any number of things, and you have a specialty that particularly I find interesting.
Thank you.
And that's balance, right?
Yes, I like to work with people with balance and problems with equilibrium, and that's what I've been doing for the last 20 years.
So I learned about you when I had a very close friend who had had a brain injury and had difficulty maintaining his balance and walking safely. And I remember the time the doctor, after an examination, said to his assistant, who is that? What was that? What's the name of that woman who does the balance? And I'm like, there's like only one woman who does balance in the world? And he said, well, no, there's one physical therapist who is particularly good at it, and I want Mac to see her. And so we got a referral to you, Kathleen, and you've been very helpful to our family. But your expertise is based on a science. Not simply an art, but a science. What is that?
Well, the balance and equilibrium was elusive in rehab for many years, in that patients would lose their balance and we would give them assistive devices and canes or walkers and crutches to help them walk. And back then I was doing brain injury research and brain injury therapy. And really my interest came when I discovered that vertigo was not being handled properly in the hospitals, and that we didn't have much to do for people who really felt so off balance that they felt a sensation of spinning in their head. And that was pretty common after a traumatic head injury, to have a sense of vertigo. So I started looking at how to attend to these patients and meet their needs. A lot of times if they said, well, when I lie down I get dizzy, the doctor would say, well, don't lie down. That wasn't satisfactory to me, so I started looking and reading, and this was before there was a field called now vestibular rehabilitation. So the vestibular system.
Kathleen, your background then, you're trained as a physical therapist at TWU?
I went to UT Southwestern Medical Center in Dallas for my undergrad, and then TWU for graduate school. Mm-hmm.
And after that you started working at TWU?
I did. I stayed on and taught, all at the same time having a private practice. So I've always been in the clinic. And as the field of balance was emerging in physical therapy as a specialty, that's why I stayed connected to the university, so I could do research and teach and develop the specialty field.
So, I mean, it's interesting when you think about it. The obvious thing to do if somebody was having balance problems and difficulty walking would be to give them a wheelchair or a cane, but you think it's not that simple, or it could be simple like that, but that's not the best solution.
Well, I've seen firsthand, and now many therapists enjoy the same success of teaching a patient to reorganize their brain and their sensory systems so their body can do things it wasn't doing before, because balance is so complicated, involving multiple systems.
So before, when that used to be the outcome, it was probably happening because we didn't know, as a field in rehabilitation, we didn't understand clearly the power of the brain to reorganize itself, the whole concept that we now call plasticity.
Exactly, exactly. I mean, this was when motor learning was coming to be and neuroplasticity, and that was the time. We understood how we could get the brain to pay attention to vision versus proprioception or versus the inner ear. And so I can, and therapists like me, can help direct a person's brain to really bias one system over the other.
Now, what I think is interesting is that you can do this in vitro. You can do it in a person's home, you can do it in their work, you can do it anywhere in the environment. The first time I learned about approaches to balance retraining happened to be when I was doing a field trip in France. And I went to a laboratory there associated with the rehabilitation hospital, and they had a very sophisticated gadget. It was a floor that moved in any direction, and they had walls on the side of it to keep the person from falling, I suppose, and they had another setup where somebody was like hanging from a trapeze, and I mean, there was a lot of wires and technology involved with that, but you've learned that you don't need all of that sophisticated technology to teach somebody to reprogram their brain.
Well, in the infancy of the field, it was so driven by research that we used lots of technology. I had a laboratory in the Texas Medical Center with the rotary chair, which was a little room where we spun people around and we put electrodes on their eyes and infrared cameras, and we measured everything. So if you were my patient years ago, all you would have felt like was a lab rat, because we were studying everything, watching the eye movements and watching reflexes and on all these platforms. So I had all that. What my love was, and after I feel like I had such a good understanding of what was going on and had measured enough, my heart was with the patients who needed help at home and in the community. And that's when I decided to forego all of the equipment and just really develop my skills in helping them at home and in the community.
So the different sensory systems that you described were being studied in the research, the
That's right.
vision and proprioceptive responses and all of that. I mean, these are things that we know about and we can teach about, and we can help people to coordinate better. And is that part of the problem, lack of coordination?
Well, it is, and also understanding the function of the vestibular system. Inside your head is this internal gyroscope, and it has two channels, if you will, a left and a right, and it works to keep you straight up and down with gravity. It helps you feel motion when you turn your head one way or another. But one of the things that I think a lot of people don't know, they might understand that part of it, Lex, but they might not know that it controls and coordinates eye movements, that our eyes move a certain way when we move because of that computer in our head, and how that communicates with the pressure you feel in your bottom or your feet or in your neck, and then how that coordinates with our awareness of our environment.
But a normal person, somebody who's not had an injury that affects their brain or some other part of their body system that is important for standing and balance, a person like you, for example, if you begin to fall, you sense that right away and your body adjusts. You tighten certain muscles that enable you to stand back up, right?
Yes, and that was part of the early research, was measuring those reflexes that are milliseconds in length, that have to be timed so perfectly to respond to keep people from falling. And we can now evaluate and see when those reflexes are just the tiniest bit too slow, they're too late, and the person hits the ground. But most everybody who falls attempts to stop themselves from falling.
Interesting.
So the reflex is there.
That's very interesting. So, in other words, the brain is still functioning.
Yes.
It might, however, be the muscle that's not responding appropriately.
It could be anything along that whole chain of the reflex, from the muscle to the sensation that I need to react, to the muscle to contract, to the pathway to the brain and back, or to the spinal cord and back, to cause the muscle to contract the right way. And then how much, how long, and when does the muscle stop contracting? It's an incredible and fascinating process, and that's what thrills me every day, to work with people and figure that out.
And all these are dynamic factors too.
Yes.
So if you have a nerve that's not working one day, it might be working another day. If a portion of your brain is affected one day, let's say you have some kind of a dynamic illness, multiple sclerosis, I think sometimes affects people differently on different days.
Right.
And so they might be able to balance one day and not the next. People who have changes in their musculature, for a long time, they may be able to balance well, but if they lose muscle mass or something occurs to them in an injury, that may affect their ability to respond appropriately to some of these other stimuli.
And there's no doubt about it that research does support that when a person has these fluctuations in their abilities, that kind of person does require a little more protection from falling. The brain is not quite as able to adapt to a situation that's always changing. The best outcomes come in the patients who have a static situation or a situation that is constant from day to day. And that produces a real good prognosis because the brain can deal with that. But when the situation's in flux from day to day, we do have to be a little more careful to protect people.
But there still are basic principles, right?
Yes.
And a person learns those principles, then they may be able to adapt themselves better.
Well, we can, and we have to protect them for the worst day, I guess. Always protecting them from the day that they
And when we talk about balance, then obviously we talk about falling, and falls are really the most frequent cause of referral among older people to nursing homes.
Yes.
Somebody falls, they break their hip, and now the next thing they're transferred to a nursing home. People don't like to be institutionalized. We know that 99% of the people who are surveyed who are elders would prefer to live at home than in the nursing home. Sometimes we have to protect them to the extent that they need to be in that kind of facility, but in reality, if we were better at helping people maintain their balance and not fall, we would reduce institutionalization.
We do want to keep people in their homes, and I think we're able to do that better now as more therapists and more home health agencies and rehab centers are able to address balance. We can send people home, even after stroke or after disability of some type, with a balance that's safer for them at home.
So this involves really understanding what's working and not working with a single individual.
That's right.
You can't generalize.
The evaluation is critical. I always say that the efficacy of our treatment and intervention depends on the accuracy of our diagnosis. So if we can pinpoint which part of the system is broken, we know how then to raise the awareness of the other parts, if you will, to compensate.
And the evaluation is not a simple process. It's not like you take your car to the garage, you plug it into the machine gives you a printout and tells you what all's wrong. It's not that simple, right?
I'd like it to be that simple, wouldn't you? And actually, that's very interesting because we try to do that with all the technology. I have patients that come from the best laboratories in the country with all the electronic gadgetry that's trying to tell them what's wrong, but still, my eyes and hands and observing them tells me a lot. And listening to the people too, listening to a patient tell their story, because it's not just what we can measure, but the emotion, the fear, the concern, and anxiety can play a big part in someone's safety at home.
And I guess their role vis-a-vis the environment too.
Yes.
You need to observe somebody in their home to know what it is they do daily so that you can plan the most appropriate therapy.
Absolutely, and seeing their home firsthand tells you a lot. How much they understand their risk and what they've already done perhaps to make them safer and what kind of accommodations we can make.
Kathleen, have you gone to someone's home and someone who's falling and you've got a referral from their physician, you go there and you immediately see why they're falling? Is it as simple as they've got carpeting where they should have a wood floor?
Well, it is true, yes, and in fact I have, and you have to work with the whole family unit. It is not always that the patient doesn't want to change their environment, but you have to realize sometimes they share a home with someone else who wants it a certain way. So to remove all the rugs, to reorganize the kitchen, to put chairs where they should be and then move things away where they shouldn't be, or reduce clutter, takes the whole family.
Okay,
So,
and you've worked on a kind of a self-help program, one that can help families and people who have
Yes.
balance problems. I want to talk with you about this
Okay.
program, but first I want to take a break from Focus, okay?
Great.
So Kathleen will be right back with me on Focus on Abilities. We're going to take a short break. Please stay tuned, and we're going to teach you how to stop falling. I'm Lex Frieden. This is Focus on Abilities, and we're here today with Kathleen Stross. Kathleen is a physical therapist, and Kathleen, your specialty is really balance and the prevention of falls in some respects.
Yes.
You've worked on a program that will help people understand the dynamics of falling and maybe help them prevent falls themselves. I'd like to know more about that.
That's right. So I call it I Do Not Fall. And those are 10 things to help people remember what the balance system is and also give them ideas on how to prevent falling in the home.
And falling in the home is very, very important because older people in particular, but also younger people who've been affected by accidents, injuries, and even illnesses, sometimes find it difficult to maintain their balance. So prevention of falling is a very, very important thing. And if people can learn how to prevent falls themselves, then they'll be safer and they'll be happier and they'll have a better quality of life. So what are the steps to avoid falling?
Well, the first one is identify. So identify the places in the home or around your home or even in the community where you're most at risk for falling. Now, a large number of falls in the home do occur in the bathroom, in and around the shower, transferring in and out of the tub, on and off the commode, in the kitchen where we spend so much of our time. Perhaps it's in the garage. People have to reach for things in the garage or even in the cupboards or the closet. So first thing is to look at where you are feeling most unstable. And most people can tell you, I feel the most nervous when I have to do such and such.
Well, is it also true if you ask them, where do you fall most often?
If they're already falling, absolutely. And if they're not falling, you ask them where they're most afraid.
Okay. So the first step is to identify.
Identify.
The next step.
The next one is to depend on your vision. Now, this is interesting because particularly with, you've mentioned people aging being at increased risk for falling, but with the increase in diabetics in this country, for example, that affects the sensation in the feet. So it is a larger and larger population of people, even younger, that are going to have some kind of balance issue because of unmanaged diabetes, in which case, along with the aging patient, we have to use our vision as our primary source of balance. And so, for that, we have several strategies. Depending on your vision means that you have to make sure that you can see where you're going at home. Turning lights on at night. I have people who adapt gadgets to their lamp so they can just touch their lamp or adjust their lamp at night to get up out of bed.
Well, it is true, isn't it? People, in the middle of the night, they get up, they need to go to the bathroom, they don't want to disturb anybody.
Right.
They try to go, they know the landscape, they try to get from the bed to the bathroom, take care of their business and get back to bed without turning on the lights, without making any noise. And invariably, if they have balance problems, at some point they're going to fall and perhaps hurt themselves. It'd be better to turn on the light than take that risk.
Well, it would. And they can have been in their house 45 years and say, I know the way to the bathroom. But all of a sudden, as the system changes and as their body changes because of disability, illness, or injury, they need their vision more than ever now. And so you have to teach them that.
It's not only the bathroom. People wander to the kitchen and try to get a midnight snack and so on. But it's true. Vision then actually helps to replace the sensation one gets from feeling in the lower extremities.
Right. So understanding the importance of that and making sure you have a clear path to go. So after depending on your vision is to open your spine. Now the reason I say that is because when people begin to be afraid of falling, the tendency very naturally is to lean forward and to flex forward because they want to see the floor. They want to get closer to the floor and they don't want to fall backwards, okay?
That's true.
So if you don't want to fall backwards, when you stand up straight and start to lose your balance, you tend to lean forward. And there begins the unfortunate progression of this forward flexed posture that you see in many people who have balance problems, right? So opening your spine means to begin maintaining your posture and allowing your body to keep its erect ability and flexibility.
Kathleen, most people would say, and their response would be family members who see a loved one who's bending over like that, the immediate response is to say, stand up straight.
Right.
It's not that simple.
It's not. The spine is changing too. And disease and aging can affect the spine as well. So it's a gradual process that happens over time. And the amazing thing is that the person who begins to lean forward over time doesn't even realize they're doing it. So to them, if you say stand up straight, they think they are.
Now, how do you, quote, open your spine?
Yeah.
That's...
Well, I teach exercises. I mean, in sitting, to open your spine might be to just reach up like this and to extend, and in standing to do the same thing. And every day I tell people, as much as you bend forward, you need to extend and open. And so years ago, when I was in school, I learned that in parts of Europe, they were telling people every time you bend over, you need to stand up and extend. And that country, doesn't have back pain the way we do, and people are standing tall.
But if people have balance issues and you tell them to raise their arms and bend over backwards, doesn't that frighten them or even cause more falls?
Well, in conjunction with the physical therapy program, we can begin them stretching their spine and opening and sitting, and that's what we do for them to be safe at home. But then if they have the opportunity to have physical therapy, they would do it standing up with assistance, with someone there in case they fall.
Okay. Open your spine. And next?
And so the next one is to find your, is nutrition. So nutrition is important in balance and equilibrium to keep people healthy. And you need protein to keep your muscles strong, and just an overall balanced nutrition, keeping your sugar in check, keeping your blood pressure stable, and keeping hydration for your muscles to work the way you need them to.
So just the same lesson. Everybody should have good nutrition. If you have poor nutrition, that increases the likelihood that you're going to lose some of the sensation and some of the feedback and some of the ability to avoid falling.
Yes, and in the morning particularly, when people go to the restroom several times in the night, and so by morning they're a little dehydrated.
Okay.
What happens in the morning? The blood pressure is the lowest in the morning. People stand up in the morning, they get lightheaded, their blood pressure falls, and they fall too.
So I do not fall, we're to the next O, right?
Yes, that's right. So the next one is to organize your space and make sure that your floor is free of clutter. People use great strategies when they organize to prevent falls, like placing a chair in the bathroom so that you can sit to apply cosmetics, to shave, or to brush your teeth.
And also to move things you have to reach frequently closer to you.
That's right. So the things in the kitchen that you use the most need to be on the bottom shelf. Things need to be on the counter where you can reach them.
Okay, T.
So the T is to train your reflexes. We talked about the reflexes being automatic, but they have to stay sharp. And the way they can stay sharp is by practicing situations where you have to call upon them. So with a therapist or with a family member, you can be trained to practice things like walking in a line, walking heel to toe, standing on one foot, standing with your eyes closed. All those are situations where you practice that stepping response that has to be quick as can be to keep you from falling.
I do not, and now we're fall, right? F?
Yes. So the F stands for find your center. Now what's important about that is that when we talk about this inner ear vestibular system that helps us with equilibrium, it automatically helps us know where gravity is and where the center of our balance is. I teach people who are at risk for falling to find that center, meaning that they would know, am I leaning heavier on the right side than the left side, or maybe I'm leaning more on my heels than on my toes. And by bringing to awareness that center point, people can find it better and then stay in balance better.
I've heard you talk about imagine you're a puppet.
Yes. Well, the two things that I say is stand tall like a string is pulling you straight up, and also sit tall like a string is pulling you straight up from here. And then feel gravity pulling you straight down, as if there's a plumb line or a pendulum hanging straight down.
And when you say that, people's brain reacts differently than they do without thinking that.
Absolutely. The verbal cues and the imagery that I use to help people find their center works. So then we teach cues to the family to say, string pulls you up or gravity pulls you down, and time again people come back and say, I still think of you every time I stand up when I hear find your center, or breathe in and find
next cue.
Find that point. Okay. So A is awareness. Awareness of your feet pressure. Now in many cases, when the vestibular system is aging or is injured and balance begins to become a problem, if you teach people to feel their feet, then the standing person can become aware of their balance better after finding their center and learn that they have to move off center.
So you think about your feet, you think about what you're feeling in your feet.
Yes.
We've got 2 minutes for 2 L's.
Okay, 2 L's. Lower extremity strength, or leg exercises for strengthening your legs, critical for those who are walking and moving and reaching and having their reflexes. Keep the muscles toned. A variety of exercises work to help that. And lastly, limit alcohol. Many of the patients who have problems with balance are community dwelling people who take a drink, find that it affects their inner ear directly and will cause them to fall. Even a little bit of alcohol acts directly on the equilibrium system to make them at risk.
Wow. So Kathleen, if somebody wants to learn more about this, they can go to your website?
That's right, inharmonypt.com.
One word, inharmonypt.com.
That's right.
And there they can find, I guess, a slideshow or some kind
All
of
kinds of
instruction.
information about balance and equilibrium and how to contact me or a colleague of mine to help you with the balance.
And the objective is not to fall.
I do not fall.
I do not fall. Kathleen, it's been a pleasure having you on Focus on Abilities today. Are there other things besides falling that you think people should really attend to when they're trying to prevent injury and avoid further injury?
Well, taking care of yourself, taking care of your environment, which we've spoke about, and then taking care of making sure they have the support systems there to support them at home and keep things free from danger.
Very well.
Thank
you
so
for
much.
that advice. For all of you, remember, I do not fall. And I want to thank you all for watching Focus on Abilities. Kathleen Stross, thank you for being our guest today.
It's my pleasure. Thanks for letting me be here.
Please tune in next time for more Focus on Abilities. I'm Lex Frieden. Hope you've enjoyed it. Thanks to HTV, and we'll see you next time.
Focus on Abilities is brought to you by Tier Memorial Hermann, redefining rehabilitation, removing barriers, re-enabling independence. In the ILRU Southwest ADA Center, promoting compliance with the Americans with Disabilities Act.